Okay, it's Friday afternoon. Um, we're presenting with this late afternoon patient. All right, feather picking. You ask any veterinarian about feather picking, and they'll tell you it's probably one of the worst topics in the world. Okay, we as humans are mammals, and then we hand raise these cute little feathered creatures. I mean, beautiful, with obvious, very intricate behavioral things going on. And part of their mating in each individual species is different, which is why they're pretty species specific. And then you let some human hand raise them, and then they get all the human problems as well. So here's a bird whose breeding and mating intricacies are off the charts as far as you and I will ever be able to understand in our lifetime. And then you give them a bottle or tell some human to raise them like a mammal, and you're bound to have all kinds of strange things going on. So feather plucking, as a general rule, we usually think as a mental disorder. Okay, a large percentage of our patients end up being completely undiagnosable. This guy's put on a pretty good show for us right now. But now if I get any closer, she will snap at the camera. Okay, anyway, so here we have an Eclectus. This is one of the stranger cases because we don't usually get this kind of a presentation. Feather plucking or feather picking is usually over grooming, and it's hard for this girl to actually pluck the feathers around her eyes. So you're actually seeing the skin there, and a little not red or irritated, but you can see it dry, kind of crusty, and the feathers are falling out around them. A feather exam shows that the feather follicles themselves at the base definitely have some exudate and some detritus and stuff in and around them. And then I actually took those same feathers and soaked them in some water and kind of mixed them all up and looked at them again and noticed that the stuff that was at the base of those feathers is actually fungal disease, including some active yeast. Okay, so this bird, compared to most feather plucking birds, actually has a rather easy diagnosis. The hard part is going to be getting this in this bird, because as I get closer, you will notice that this bird wants to eat the foam and doesn't like mom much. This bird is lightning fast, I'll tell you. I almost lost a finger right in there. So anyway, Dr. Danger just almost got in trouble again. So when it comes to most feather plucking cases, this is actually kind of neat and interesting, the fact that we actually do have some true pathology going on here. So from what I'm seeing, we definitely have one of those types of yeast that likes feathers, doesn't really like the skin too much, but I think it eats feathers more than it eats skin. If you'll notice in here, oh stop, I'm working here. Working, watch out, back this up a little bit. Right over here. What? On the other side of the beak, on this side, there's actually one of the feathers you can actually see is kind of black. Right there. All right. Where one of the feather follicles is actually, the blood supply has actually been messed up. In a lot of other feather plucking cases, you'll see that pretty much all over the body or wherever they can get to. So obviously there's something itchy going on there, but of all the feathers that have been injured, that is the only one that shows that sign of self-mutilation. Okay, now, all right, with all that in mind, our breathing is fine. Looks like our heart rate is great. I've watched this patient now for a while. I have not gotten a fecal sample yet, which I find odd for a bird, but we're gonna go ahead and start some antifungals. I hope Mom can get them in the bird, and we may try a spray as well. That's it for now.